Hello guys and welcome back. So today is a very important topic, that is drunkenness. How to examine a case of drunkenness or how to proceed. We will be demonstrating the various tests through videos. So first of all, what is drunkenness? Drunkenness है क्या? Drunkenness. What is drunkenness? So guys, drunkenness is basically the condition. It is a condition which is exactly from excessive consumption of alcohol. So it is the condition that develops because of excessive consumption of alcohol, and after excessive consumption of alcohol, what happens that there is the person loses control over his mental faculties. So there is loss of control over mental faculties. Now the second point is, then the person is not in the condition or in the position to safely do the duty, any kind of duty in which he is engaged at the material time. So at any material time, the person is not able to perform the ordinary the duty safely, any duty at any material time, and or maybe the person is source of danger to himself or to others. So a तीन point important in case of drunkenness. It is a condition in which the person loses control over mental faculties. Person is not able to do the duty safely in which he is engaged at some material time. Then person is dangerous to himself or to others. Now the word drunk in itself signifies that person is under the influence, and person have lost the control over mental faculties and not able to perform the duties, and dangerous. The person is dangerous to others as well as to himself. Now there are various tests available for drunkenness depending on the stage of the alcohol or the blood alcohol concentration that we have discussed in previous videos about the alcohol breath test or the breath analyzer test that is done by the police personnel, and other tests for clinical assessments are nystagmus that can be horizontal gaze nystagmus or vertical gaze nystagmus. Because of the alcohol consumption, there is a oscillatory movement of eyeballs. So these moments can be observed by doing horizontal as well as the vertical gaze nystagmus. Usually this nystagmus comes around 80 milligram percent of blood alcohol concentration. So this is the level at which you can see the nystagmus. So this is the first test. We will be demonstrating the nystagmus, how to do the nystagmus in the alcoholics or the person who is drunk. Now the second test, how to assess the gait of the person. This is very much important, how to assess the gait of the person by doing simple walk and turn test. So what is this test? Walk and turn test is simply always explain everything to the person, and then cross check whether the person has understood everything or not. So just make him understand the procedure step by step, and ask him to walk 9 steps on a straight line, 9 steps, then turn back and return by similar 9 steps on the very straight line, and these steps should be on heel to toe walk. Heel to, suppose this is the toe of right foot, then heel of the right foot. This is the right foot, then the left foot will be behind this, and the toes of left foot will be behind the heel of right foot. So heel to toe walk will be there, and ask him to walk for 9 steps and then return back and reaching at the same level. Then observe the swaying. The other person is able to walk or sways or any kind of abnormal posture. If the person is not able to walk heel to toe or any kind of fall, or person is not able to follow, not able to walk full 9 steps, so observation makes this test positive, and this is known as walk and turn test. This is very much significant while analyzing a case of drunkenness. So walk and turn test for assessment of gait. Now another test, that is the single foot standing test, single foot or single leg standing test, in which you will similarly explain everything to the patient and ask him to stand on a single leg, and another leg will be about 6 inch, another leg will be about 6 inch above the heel, 6 inches above the heel, and ask him to stand on single leg. Now observe the similar findings, sway, if the person is able to stand or not, or any kind of abnormal posture, or any kind of balancing. So these are the main findings which makes this test comes out to be positive. So this is the single leg standing test. So basically we have 3 tests, and we will be demonstrating the 3 tests in videos. So keep on watching and stay tuned. So guys, this is assessment of horizontal gaze nystagmus. As you can see, the subject is moving his eyes towards the stimulus, and this is the vertical gaze nystagmus, in which the subject is moving his eyes in vertical dimension, and you will check the oscillatory movement. Now this is the walk and turn test, in which you will ask the subject to walk on a single line by heel to toe walk, and check for swaying or any kind of abnormal movements. Make sure you have explained everything and the subject has understood everything very clearly. So this is walk and turn test. Now this walk and turn test is basically the assessment for the gait. Now this is the positive walk and turn test, in which the subject is not able to walk on a single line. As you can observe the swaying movement, and this person is putting efforts while walking heel to toe. Now this is the single leg standing test. The second leg is around 6 inch off the floor, and the subject is standing on the single leg. Now this is positive case, in which the subject is not able to stand on a single leg. So this is all about alcohol filled sobriety test.